Well, in the midst of this crisis, experts are certainly back in vogue, and the government has put scientists at the centre of its response to coronavirus. So Mark Walport is the former Chief Scientific Advisor, and in his new role at UK Research and Innovation, he's leading the charge to find a vaccine to the virus. Thank you very much for being with us.
Morning.
Much appreciated. So just on the vaccine, how far away realistically are we?
Well, vaccines are being developed at a very fast rate, and so there are a number of candidates. Big companies, small companies, universities are all working. The challenge here is to make sure that the vaccine is safe and that it works, and unfortunately that takes a period of time to do. So realistically, it's very unlikely that we're going to have a vaccine for the present round of this epidemic.
You say it takes time. I mean, are we talking months,
We're talking,
years?
we're talking months, but so, up to a year.
Yeah, up to a year. Thank you. In that case, obviously, knowing how quickly this spreads, are most of us going to get coronavirus?
Over time, it's quite likely that a large percentage of populations around the world will get it, most of them very mildly indeed, and many indeed subclinically. And if you like, the scientific information that's needed at the moment is, firstly, how do we most effectively reduce the transmission of the disease, because that's the best way of controlling it and enabling new treatments and vaccines to be developed. That's the first thing. The second thing, we need to understand the virus and its effects to develop new treatments. And of course, thirdly, we need to keep society functioning. And so the scientific advice to government is in all three of those areas, and there are trade-offs, as you've heard. So if we want to look after vulnerable elderly people, they need people to come and look after them. If we need the shops to keep going, then we need them to be supplied. Modern society is a very complex system, and we need people to be able to work.
Can you explain a bit of the science behind the government's approach? Because people will be looking at what different countries are doing around the world, and they won't understand why it is, for example, that in Ireland schools are shutting, but schools and nurseries are being kept open in here. In France and Italy, they're closing bars and restaurants, and we're not doing the same.
OK, well, I mean, the first principle is, how do you reduce transmission in the most effective way? And that is about social distancing. But the goal here is also to look after the vulnerable who do need care, and also try and protect the NHS from being overwhelmed. And so the idea is, as sometimes described as, flattening the curve. So if you have a very steep peak, then it means that systems potentially become overwhelmed. If by distancing you can slow it down, that's the best thing to do. Now, already the scientific advice is to, if you have an infection, or if you have symptoms, to self-isolate. So people who have fever, who have muscle aches, who have dry cough, stay at home. And that's one way of reducing the spread of infection. Now, I mean, you can go to a very extreme model of this and try and shut everything down, but then society does stop working.
We can have a quick look, actually. I think we've got a bit of a graphic just to try and illustrate some of this, to show what different countries are doing. You can see that lots of sporting events shut in the UK, the self-isolation, as you were talking about. Then if you compare it to, say, Italy and China, they've got ticks all the way along. I mean, do you think we are going to see, as the months and weeks increase, more, for example, school closures in the UK?
I mean, I think the answer is that, of course, as the epidemic does potentially gather pace, then there will be more limitations on people's movement. Schools is an interesting problem, actually. It's at the moment, it's clear that young people show very few signs of infection.
But they could spread.
But they are still getting infected, there's no doubt about that. But it's not clear, actually, whether the young are getting their infections from the older, or the older are getting their infections from the young, and that's one of the important research questions.
It looks, speaking to Matt Hancock, it's pretty clear that perhaps the next stage of the UK government's response is what you were referring to as effectively shielding. So asking those most at-risk groups, over 70s, perhaps those with underlying health issues, to self-isolate. How important is that? Well,
the answer is it will be important, but these things can't be done in an absolute sense, because elderly people have to have supplies of food, they have to have the necessary care. And so it's not going to be possible to completely shield people from...
Should people start doing it now? I mean, lots of people will be watching this thinking, I'm over the age of 70, or my mum or my dad is. What's your advice?
Well, I mean, my job is actually to provide the scientific advice through funding the research. So in my previous job, I was doing the job that Patrick Vance is now doing, and of course he's working closely with Chris Whitty, who's the CMO. So my job is really to provide the evidence. In terms of the advice, I mean, I think it's very difficult to give general advice. It depends on the individual situation.
It's a judgment call.
It is a judgment call, and all of this is judgment calls. And one thing I would say is that the UK has the most deeply embedded system of scientific advice in emergencies, I think, of any country in the world. And so the UK was prepared to provide good scientific advice to government, unlike, I'm afraid, a number of other countries. On the National Risk Register, pandemic infection has been the top risk for many years.
You mentioned other countries there. Do you think some of this has been driven by politics rather than science?
Well, inevitably there are judgments about this. So, for example, actually a large outdoor gathering, there are, of course, risks, but there are also risks from 50 people in a closed environment if one of them is infected. So all of these things are a judgment. It's about how you do keep society going in the most effective way possible.
There's been lots of talk about herd immunity.
Yes.
Where effectively 60% or more of the population get infected and then become immune to try and limit the spread of the virus. We've been told it's not the government policy, but...
I think it really isn't the government policy, and I think this has become, the narrative has become a bit confused about this, to be perfectly honest. What's going on is that the primary concern is to save lives. It is about protecting the most vulnerable, and it's relieving pressure on the NHS. Now, it is perfectly true, over time, as more people become infected and immune as a result, then they can no longer spread the infection. And of course, the way that vaccines work, ultimately, is by giving herd immunity. In other words, what happens is when a large percentage of the population is immune to a condition, and it is typically through vaccination, then the transmission reduces. But I think that this is not the narrative, actually. That is not the policy of the government. The policy is, as I say, to reduce the transmission and save lives.
You're very keen, of course, to emphasise the science that the government's working on. What I can't work out is why isn't the government publishing all of this evidence?
I mean, the short answer is that I think that they are about to publish all the evidence on which the modelling is based.
It would have been reassuring for many people to have it from the start, though, wouldn't it?
I think that's true, but I think one has to recognise that, if you like, in the heat of battle, what the researchers are really working on is analysing a flood of information that's coming in very fast indeed. And so there are at least 2 independent groups of modellers, infectious disease modellers, that are advising the government. They're working very hard on data that is emerging on a day-by-day basis, but the government have agreed that this should be published, which I think is absolutely right.
Should it have been done earlier, in your view?
The retrospectoscope is an infinitely powerful instrument, and at the end of the day, people will look back on this and work out what was right and what wasn't. It's worth saying that we are also, in UK Research Innovation, working very hard to create a lay source of the scientific information that people can go to if they want to find out about a bit more of the details about the science, what the virus is, how it transmits, what potential new therapies are, and we'll be getting that online sometime in the next week.
I'm interested as well to know about what you think the trajectory is. What is going to happen in the weeks ahead? Lots of people will be feeling it's almost like the calm before the storm. I mean, how far away is Italy from the peak?
I mean, the short answer is it's always easier to predict the past than the future. But the answer is that this is a spreading infection. It will continue to spread. There will be more cases in the UK and around the world.
So even in Italy, there's still some distance away from the peak?
I think that's right. And the other thing to say is that if you isolate everyone, then it's a bit like putting out a fire. If you deprive it from oxygen, then the flames will go down. But if you have any embers left in that fire, the second the oxygen comes back, you'll get an outbreak again. And so it's this balance between trying to smooth it or dampening it down with the risk then that it will come back. But the answer is that this infection has a long way to go around the world yet. There's an awful lot we don't know about it. And that's why research is so important. And we and others, the government's committed already over £75 million specifically for research in the last few weeks. And the other thing to say is that we are prepared in the sense that the Medical Research Council, which is part of UK Research Innovation, has a Centre for Global Infectious Disease Analysis, which has been going for years. And the modellers who advised here were very helpful around Ebola and Zika when I was the government's chief scientific advisor. So these aren't being plucked from thin air. There's a centre for virus research in the University of Glasgow. In Oxford, there's a human immunology unit which is working on vaccines. And so our research system, and if anyone wants a justification for why fundamental research matters, it's this, where we actually understand viruses. This is the first time ever in history that within a few weeks of a new virus coming out, the whole sequence of the virus was made available, and so the Chinese released that.
Some things to be optimistic about, despite the
yes, I mean, you don't have to go very many years ago, and we'd still be struggling to work out what this virus was.
Realistically, in some ways, these questions are always difficult because you don't want to sound alarmist, but I think people do want to know the scale of the problem that we're talking about. How many deaths are we talking about potentially in the UK? Is that too difficult to answer?
I think it's too difficult to answer specifically, because one of the other important things to know is that we don't know how many cases are completely asymptomatic.
Yes.
And there is an important reason for that, because there are tests of two sorts. So the test that's being used at the moment is a test to identify the virus genome. And so that will detect active infection where there's virus present in swabs, for example.
Okay. And very briefly, will this always be with us, like seasonal flu?
I think it's very difficult to answer that. I mean, coronaviruses have been around, and in fact, there are about 7 coronaviruses that infect humans. The early ones, actually, that were discovered basically cause cold-like illnesses. But then we've had SARS, which was in 2003. We have at the moment a virus called MERS, Middle Eastern Respiratory Syndrome, which is a very nasty virus, and that came out in 2012. And now we've got this one.
OK, thank you so much for coming on and explaining some of the science behind what we're seeing happen. Much appreciated.
Thank you.